Hey guys, Dr. Justin Marchegiani here. Today we're going to be talking about the top 5 secrets to helping improve your hair loss. We're going to compare natural options as well as the pharmaceutical options, the drug options, and which one should you choose. We're going to dive into that topic today. And before we do, please smash the like button, thumbs up, and love to see your comments down below. And make sure you subscribe so you get notifications like this. All right, so let's dive in. So I'm in the trenches. I'm a functional medicine doctor for the last 15 years. It's getting close to there. It's crazy. Time flies when you're having fun. But I deal with patients every week, male, female, coming in with all kinds of health concerns, digestive, female hormone, energy, mood, etc. Hair loss is always one of those things, right? And how you treat and address hair loss in women is different than how you address hair loss in men. Now, when you typically have hair loss, there's 3 major kinds of hair loss. You're going to have androgenic alopecia or male pattern baldness. This is going to be baldness that is progressively increased by androgen. So you have the major androgen guys that is testosterone. That hormone can metabolize into DHT, dihydrotestosterone, and that can impact blood flow to the hair follicle, and it can decrease nutrition via decreased blood flow and cause the hair to miniaturize. So every time you lose a hair, that hair comes back a little bit thinner, a little bit thinner, a little bit thinner. One of the best ways to know that is take your hair out of the drain or put like a little drain catcher in there, see your hairs, line them up, and you're gonna see maybe some hairs that are thicker and bigger and some hairs that are thinner and more wispy. That's a sign that the hair is miniaturizing. And so the biggest thing with androgenic alopecia is you have to drop that DHT to significantly impact that. We'll talk about options to do it. And then you're going to have your telogen effluvium, which is going to be more of a systemic hair loss that kind of happens. And this can happen due to like emotional stress. And that hair loss will happen over time. It'll happen diffusely across the whole hair, where typically with androgenic alopecia, it's going to happen in that Norwood 1 through 7 area. So like 1 would be like you're starting normal. Like I'm probably like a 2, but like a 1 is like, your juvenile hairline where it's like very straight across. And then it starts to peak back maybe in these corners here. And then it peaks back more until you have a 7 where you're a George Costanza, where this whole area starts to be open on top. And then maybe Norwood 3, the crown, the vertex starts to open up. With women, it tends to be a little bit more diffuse. You'll see it more, it's called a Hamilton scale, where it starts to just come, you'll see a bigger scalp line in the middle part, and then it just gets wider and wider and wider and wider. And it's different. With women, hormones play a big role, progesterone, estrogen. So as a woman goes into menopause, that can play a bigger role. Of course, stress and the cortisol caused by that stress can definitely be a problem child as well. And then you're going to have your alopecia areata or your different scouring alopecias that tend to have an autoimmune component. You're going to see big blotches of hair gone. You can get scarring from that autoimmune response. That's part of the reason why we always like to work on some kind of a diet and good nutrition, because if you're increasing autoimmunity, which a lot of people have, a lot of women have too, a lot of guys have, due to gut health issues and toxins in the food and gluten issues and food allergens, there's always that potential in the background. So we always want to assume that could be there, so we're on top of it. So those are your big 3 types of hair loss, okay? So when we look at that, we always want to put people into a category. If I'm dealing with a male, one of the big things we're going to do out of the gate, let's compare. And these aren't theoretical things. Like I'm actually in the trenches seeing this, and I do a lot of this stuff myself. I mean, I try to keep my hair. I'm 40 years old now, birthday last month, and I'm trying to keep my hair pretty good. I have a lot of balding in my family on both sides, and I'm doing a pretty good job, and I'll talk about the things that I'm trying to do here myself with you guys. So top 5 ways. First thing is we have to get DHT down. Now on the pharmaceutical side, there's things like finasteride. Finasteride has a bad reputation. Now, the side effect profile on finasteride, according to the peer-reviewed data, is about 2%. Now, why would someone get an issue with finasteride? Number 1, finasteride can actually increase testosterone 20%. So let's say you're aromatizing a lot of your estrogen, and let's say you have not fixed the root underlying issue of your aromatization because of insulin resistance, because of inflammation, then as you increase your testosterone, where does it go? It can go to estrogen. And so part of the reason why you may have side effects with finasteride is this aromatization happening due to the increase in estrogen, due to the increase in testosterone aromatizing to estrogen. You can also have very low testosterone and high DHT. And then as you lower your DHT to nothing, now you have no androgens supporting you at all. So the big side effects I find is guys that have good testosterone or maybe okay, but they're aromatizing a lot. Maybe they're overweight, they're inflamed, they're eating a bunch of processed food. They're like, let me get on finasteride. They bump up their androgens a bunch, but then it aromatizes. Or guys that have very low androgens to begin with on the testosterone side, they're good on the DHT side. DHT is kind of pulling the weight. Then you block it down to nothing, and then now your androgen level is super low. Those are the two big kind of patterns. So like when people say, oh my gosh, like finasteride cause, it's like, well, you have to look, do you have this pattern, right? And if you know that, then we can be on top of that. We can do things to mitigate that, but that'd be a whole different video. But I tell patients, don't guess, assess, figure out where you're at. So that being said, I've seen many people actually do very well on finasteride. Now, I always recommend doing finasteride topically because there's some benefits to DHT in the body maybe that we don't quite know about. There's some neurosteroids with the type 1 isoform. That'll get blocked more by like an Avodart or a dutasteride. Dutasteride blocks the type 1 and type 2, where finasteride blocks the type 2 isoform. About 70% will get knocked down with a 1 milligram dose of finasteride oral. Goes to the liver, and then that blocks all the DHT production. I prefer going topical because we don't know all the other benefits, and we want to really impact DHT on the scalp because it's really the DHT receptors on the scalp that really cause the problem. Like people will use DHT growth, to stimulate beard growth, right? So DHT on the face has a totally different impact than DHT on the scalp based on genetics and the receptor sites. So big thing out of the gate is finasteride, you can do it topically. I always recommend lower dose. If you look at some of the earlier studies like 1999, the Mazzarella study, there's some other studies looking at topical finasteride. It's logarithmic in how it works. And so a 0.1 milligram dosage will still knock out about 80% or so of the amount of DHT that a 1 milligram dose. So, 90% less or 10 times less dose does almost the same thing at an enzymatic level because we're trying to block this AR enzyme. Alpha reductase, 5-alpha reductase is the enzyme that converts T to DHT, testosterone to DHT. So if we suppress that AR enzyme, that's what finasteride is doing. It's blocking that enzyme, decreasing testosterone's conversion to DHT. And so if testosterone, it can no longer go this way, then guess what? It goes up. That's part of the reason why some people actually get improved libido, improved testosterone, right? I told you the pathways where it can go sideways. That's why anytime you're increasing testosterone, you want to make sure that you're keeping your insulin in check, your inflammation in check. And if you're on the fence, you can always increase things like increase your glutathione, increase your diindol methane, your DIM, etc. So big thing is DHT. If you're going to do it on the finasteride side, choose a liposomal topical finasteride, get it compounded, and start at a lower dose. Now, if you're in your 30s or 20s and you're just trying to be on top of it, you're trying to be more preventative, I recommend using a saw palmetto out of the gate. Saw palmetto, I'll pull up some peer-reviewed data on it. There's a wonderful study I read a few years ago on the topic. Very helpful. Let me pull it up for you guys. Okay, so natural hair supplement, friend or foe, saw palmetto. This is a good systemic review. Now, what they found, the optimal dose was about 350 milligrams a day, and 2 divided doses seem to be optimal. But right here, 60% improvements in overall hair quality, 20% improvement in hair count, increase in hair density, 83%, and then stabilized disease progression in 52%. So that's really good. That's nice. It's good to have that option. So definitely stabilize is a good goal. Now, the data wasn't robust. If you can go in here, it kind of looks at some of the mechanisms, right? Saw palmetto is a competitive, non-selective inhibitor of both 5-AR isoforms, but it also blocks the nuclear uptake of DHT and decreases DHT binding capacity. So what this means is it's blocking the conversion, but it's also blocking the uptake into the receptor site. So you kind of have dual roles, right? With finasteride, you're not getting the blocking of the uptake, you're just getting the blocking of the conversion. So it works dual. So that's why my recommendation is to take saw palmetto orally, but then also use it topically. So typically about a 100, like a 200 milligram ish, like a 175 milligram capsule twice a day. I like an 85% extract, so it's in a liquid form. I'm not a huge fan of the powders as much. I feel like the absorption is better when it's in a fatty acid liquid form. And I like it. I do it topically. I also do a 1 milliliter disbursement at night, over the crown, over these areas, and then you just gently kind of massage it in. That way I know I'm blocking the receptor sites as well, because it says right there, right? Blocking the receptor sites. And so this is super helpful. If I know that, then I think I can get, in this study, guess what? Not one of these studies looked at topical and oral. They looked at some topical and some oral, and they all showed benefits. So I'm like, well, why don't we just do both, right? I mean, it's just a no-brainer. And so, yeah, saw palmetto. Now, the product saw palmetto that I personally use has pygmea bark in there. It has stinging nettle. It also has pumpkin seed oil. All of those individually have shown to be very helpful with DHT. So I recommend that saw palmetto because you're getting other compounds that are still going to be reducing DHT, which is great. And I'd much rather not, when you use natural compounds, like when you look at the side effects of saw palmetto, guess what? It's a little bit of tummy upset. That's it. That's the major side effect. So you don't get gynecomastia. You don't get any other types of side effects. So starting off, if you guys are on the fence or you want to be more in a preventative mode, you're in your mid to late 20s, early 30s, or you're starting out and you're just saying, hey, I want to be more on top of this, oral saw palmetto, topical saw palmetto. That's a good starting point out of the gate. This is good. Excellent. Let me go back here. And so, yeah, you can see here, they looked at 9 articles. It's good. I mean, this is a really good article to look at. We'll put the notes or the link in the description. Very good. All right, let me come back here. All right, so we have reducing DHT. Now, we can also throw in, there's been some studies looking at reishi mushroom reducing DHT. That's been helpful. Again, how long? That's the issue. Like finasteride works so well because its binding impact on the receptor site and reducing the enzymes in the scalp is like 5 days. That's why when you look at the studies with finasteride, you don't see a reduction in DHT for about a month, right? You don't see the DHT start to go up for about a month. And so and it builds up in the system. And that's why if you're going to take finasteride out of the gate, talk to your prescribing doctor. But I always recommend doing it every other day. And I never recommend the full dose. I recommend a micro dose out of the gate because of the logarithmic effect and its bioaccumulation over time. So I always recommend that. And if you're going to start off, saw palmetto, the data supports it. And there's no one looking at topical and oral. And we see the topical does bind that receptor site too. So I recommend it just like that. And so that's a good way to hit it out of the gates. Now, growth stimulants, minoxidil, 5% is going to be your gold standard. And the issue I have with minoxidil, it's got lots of, so finasteride, liposomal compound, it's better because of the absorption. If you look at some of the big brands you see on Facebook, like Keeps or Hims, the big issue with that is you're going to see 0.03%. That means 3 milligrams per serving size. So you're actually getting 2 to 3 times the dose that an oral finasteride capsule would give you. Well, most people are doing topical because they want to lower the systemic load, right? They want to maximize what's in the scalp, but lessen what's systemically there. You don't really do that. And so I recommend being in that microdose level between 0.1 and 0.5 milligrams and then get a liposomal formula that prevents the systemic absorption. That's a better way to do it out of the gates. Now, growth stimulant-wise, minoxidil is a great way to go, 5%. Just got to look at what's in there. If you look at a lot of the Kirkland's brands in Costco, it's a lot of greasy stuff, a lot of propylene glycol kind of antifreeze stuff. If you're going to do minoxidil, try to find a better brand. I'll put some links to some products I like that just don't have all the junky fillers in there. And you do it at nighttime. They say do it twice a day, but maybe for a loading period for a month. But in general, minoxidil's half-life is 22, 23 hours, so it doesn't make sense in the end. Now, if you're going to do natural things with it, you can do castor oil. That's going to work on the PGE2 pathway, which vasodilates, opens blood flow up, and that also decreases the PGD2, which is constriction. So it decreases the constriction, increases the vasodilation. You can do it topically. Like a lot of women will do it on their eyebrows. Their outer third's gone. They'll microneedle the outer third and hit it with castor. Great. You can also do it orally. I do 1 milliliter of castor oil every morning. Just put it in a amber bottle, do 1 full dropper, which is 1 ml. Shoot it in your mouth. That's it. Biggest side effect is going to be loose stools if you have an issue, so start low and taper it up. But that works great. You could also do it topically. I'll put a product that I like as well that's a good DHT supporter. It's got saw palmetto, but it also has castor oil in there as well and some pumpkin seed oil. So that's a good product that I like as well. And you just put it in an amber bottle and just do 1 milliliter on your scalp every day. And then I would also do castor oil orally in the morning as well. Very helpful. Now, microneedling is awesome. Everyone should be doing it. It's a no-brainer. I do it once a week. I've done videos on this topic at all so you guys can see it. But, get the Dr. Pen 8. It's a great one. Get the 16 pens, really good for the scalp. Do on the 6,000 RPM cycle. And I just kind of come here and I just start from my crown, my midline here, and I just go straight back. And I just kind of arc it like this. So if imagine this is my crown, I just go like this. So it's just kind of going from the midline and then out. Just like that. And it's obviously a little bit slower. It's going to be about this speed. And then up here, same thing. I'll kind of come in. I'll almost feel like I'm combing it. So if I'm combing my hair like this, right? If I comb it like that, so I'm almost combing it with my individual microneedle. I'm just combing it like this. I'm going that slow. And then I'm also tracing, because most guys, their problems areas are going to be here. So I'm tracing here. I'm even going a little bit below where I'd want it to be. Maybe I can get some growth factors in there. And I'll come and trace this area nice and slow. And I'll trace my sideburns too. And on the other side too. So that's how I recommend it. But that's great. 10 minutes a week on that's wonderful. Great way to do it. Do it after you shower. Very good thing. You can also add in rosemary oil. There's some studies on comparing that to a 2% minoxidil, which is more of a female dose on the minoxidil side. And rosemary is shown to be helpful. And you may want to combine these in your own little essential oil kind of growth stimulant. But if you're going to do some of these things, you have to understand the timeline, right? Finasteride, do not do it unless you're willing to commit for a year. What happens is when you start to use and block DHT, the hair cycle gets synchronized. And so hair cycle 101, right? You have anagen phase. It grows. Hair's growing, 5 to 7 year growth phase. Which DHT does, it shortens the anagen phase. So now you have a shorter anagen phase, then you go into a catagen phase where the hair falls out, and then you're in this telogen phase where the hair's resting. And so the goal is that you start to synchronize the anagen, catagen, telogen. You start to synchronize it so you have more hairs going through that cycle at the same time versus alternating. So you have more synchronization. People are like, oh my God, what the heck? I'm shedding like crazy. It's like, no, it's just synchronized. You got to push through it. But because now you're reducing that DHT, what starts to happen is that follicle can come back thicker. And then if you do things that stimulate the anagen growth phase, like a minoxidil, microneedling as well. And again, microneedling works so well because it activates the transsulfase enzyme in the scalp that activates minoxidil, right? Why does minoxidil only work on a third to half the population, right? It's because they don't have the enzymes in the scalp to activate it. So you can do one, you can add in tretinoin or get minoxidil compounded with tretinoin, and or you can do microneedling once a week. The studies on that from Japan, 2014 study, 400% increase in hair growth, 6 days a week on day 7 using microneedling versus all 7 with minoxidil alone. 400% increase. That's insane. And so it's a no-brainer. Add that in. And guys, you can also do it on your facial hair. If you add minoxidil to your facial hair, what it increases for hair is permanent, right? You don't have the golden handcuffs with minoxidil on your facial hair, where on your hair, if you stop doing it, you will start to have that shed because you're no longer stimulating that anagen phase, right? It's working on the sodium potassium pumps. Some say blood flow, some say not, but it's stimulating that anagen phase. All right, let's keep rolling on this. So we have our anti-androgen. So we have some drugs. The pyrolutamide medication just went through phase 3 clinical trial. The data wasn't that great. They're thinking, some of the androgens it's blocking, like testosterone, maybe aren't the big input. They're thinking finasteride's obviously much better. DHT's the bigger player. The RU58841's been around for 10, 20 years. A lot of guys on Reddit will talk about this. It's kind of a staple in the Reddit forums if you look at it. Some guys will do it and do well on it, but it's experimental, not FDA approved, so caution, right? Definitely go with tried and true staples. Again, if you're worried about finasteride, low dose, go topical, and then if it's not severe, just start with soft palmetto, oral and topical, and then now you got a good path going there. But the number one mechanism you have to work on for reducing hair loss as a guy is DHT. It's the number one. Women don't have it as much. They have 10 times less DHT, so it's not as big of a deal. But it still can be. If you have, PCOS and such, it could definitely be a big deal. Ketoconazole shampoo, right? So some people say it works because some people that have hair loss have a low-grade fungal infection. Others say, well, ketoconazole 2% also has anti-androgen impacts on it. And now, typically, you'll get the Nizoral 1%, but if you go to keeps.com, you can get the 2% there as well. It requires a prescription. There's also another one from another group that I like, a Revitin group that works good. I'll put the link for these down below as well. So yeah, you have your anti-androgens. That works good. Now, oxidative stress. Okay, so really good one. NAC is amazing for oxidative stress. There's one study where NAC compared to minoxidil actually did better. I'll actually pull up a study. I'll pull up the government study. I'll just show you guys. I'll bring the receipts. NAC versus minoxidil. The government, I think, that funded a phase 3 clinical trial 2 years ago, and I couldn't believe it. I was like blown away. Here we go. I'll pull it up for you guys. All right, cool. Efficacy and tolerability of NAC for treatment of early onset of androgenic alopecia in men. So we'll go to the conclusion. On the basis of the findings of the current study, we can conclude that the role of trichoscopy, that's the hair scope, and increasing the accuracy for diagnosing hair disorders as well. NAC improves significantly most triscopic features of AGA, that's androgenic alopecia, and it was generally tolerable, and the side effects did not necessitate stopping. And they were comparing it to minoxidil in this group. It actually did, I think, better. So they did NAC as a single therapy in combination with minoxidil. And so they found that the NAC just by itself was great. So I think that's awesome. NAC works amazing, does a lot of different things. It's a free radical scavenger, so it'll reduce oxidative stress. Also, the catalase, the pseudocatalysis enzyme that's responsible for graying of hair, because what happens is you get this hydrogen peroxide that over time accumulates at the hair follicle, and the pseudocatalyse enzyme is glutathione derived, and NAC is the biggest cofactor for it. So if you increase the pseudocatalyse enzyme via glutathione, that helps to neutralize hydrogen peroxide more. So if you're trying to reduce gray hairs, that's a great thing to put in there. Also, a good anti-inflammatory support too. Okay, so NAC is great. Curcumin, also good. If you look at some of the bigger, products online, like I think, not Follistem, but there's another big product out there. I'll pull it up here on Amazon and see. But if you look at some of the ingredients in their products, guess what? It's curcumin, right? It's curcumin. It's going to be those big things out of the gates that I mentioned. Yeah, Nutrafol. Yeah, so if you look at theirs, they have some of the curcumin in there. Very good, very anti-inflammatory. And curcumin also helps to reduce DHT at some level, but also helps with oxidative stress. Red light laser. I mean, I have a Capillus cap. I think they're great. I have the RX prescription-based one. It's like 300 and something lasers. It's one of the only ones that's a actual laser light. There's LED lights and laser lights. The amount of lights matters. The amount of joules that you get from it, like the Capillus RX, the highest grade one, you get about 15 joules per 6 minutes. So that's pretty powerful, and you get great coverage. And so that's great, helpful. It's not going to be the be all or end all. It may give you a 5% bump. You just got to go into these modalities knowing that like nothing is going to be the magic one. Like DHT will give you the best benefit, followed by minoxidil. Those are going to be 1, 2. Now, you can come in there and block DHT with saw palmetto, and you can do some of the essential oils if things aren't going as fast. If they're going fast, you really have to bring the physiology back down. So again, you can bring in the minoxidil, you can bring in the microneedling, you can bring in a topical DHT blocker or a pharmaceutical one if you need. These can be helpful out of the gate. But the laser light, that'd be like 4th or 5th on my list. It's not going to be the prime thing, but it's helpful. I mean, if you got the money and you want to throw it at it and just, I keep mine. It's right over there on my side of my desk, 6 minutes a day while seeing patients. Done. Easy. No brainer. So it's good. It works. There's studies on it. Just got to get a good one that's actually therapeutic. The LED lights, you got to look at how many joules are coming out of it. Really, it's the amount of joule energy really makes a big difference. Nutritional building blocks, right? This is key. Like if you're not digesting protein that well, or if you're not consuming good collagen in there, right? You're eating a pro-inflammatory diet, lots of processed refined vegetable oils. Your diet does matter. Now, you can see people who literally have crummy diets, but genetically their hair is just less prone to DHT attack. It won't matter as much, but I'm telling you, if you are susceptible to DHT and you improve your diet, you will have better outcomes overall because you'll have less inflammation. Inflammation drops blood flow as well. DHT also drops blood flow. So it's possible that you're improving blood flow even though DHT is blocking it, so you have less net blood flow loss overall because your diet's healthier. And also building blocks, right? Keratin's the major protein of hair, and you need collagen and biotin and good protein-rich building blocks to build it. And so if you're not eating it, you're eating crap, or you're not digesting it because you have a leaky gut and poor hydrochloric acid levels in SIBO, that could be a problem. So make sure your collagen, make sure your biotin, make sure your building blocks are there. Also, I didn't really talk about it here, but you could have low thyroid function. T3 is a very important factor, right? Your triiodothyronine, that's your active T3 hormone. It does stimulate hair growth. And if you're a female, this is super common. Low thyroid, right? Low thyroid is 5 times more common in women than men. So low thyroid could be a driving factor of telogen effluvium hair loss. Also, lower progesterone, lower estrogen, those things, and cortisol being out of whack can also drive hair loss too. So keep that in the back of your head as well. So when you look at hair loss, you don't want to say, I'm going to just do this one thing. Try to pick 3 things. Now, the more severe it is, you may want to add in a pharmaceutical intervention. The more you're catching it early or you're trying to be preventative, you may want to try something more herbal. What I recommend is get your phone like this. Go shower, comb your hair, have everything nice and dry. Don't do it at the end of the day when your hair's greasy. Do it after your hair's dry. It's parted. It's how it should be, but it's dry because when your hair's wet, the hair follicles shrink. And then go snap a picture like this, head on, right over top, and then right in the side. And just do it in good light, not like a harsh light right on you, but good light, back, front, right, very front. And then just put them in an album in your phone, and then just every month, just scroll through it. And then when you start to see that reduction, then maybe you go from something more natural to a more pharmaceutical intervention if you need. But document it, because people on average lose 5% when you're going through androgenic alopecia, 5% hair loss per year. Well, if you have 100,000 hairs and you're losing 5,000 out of 100, you may not see that. Or if your hair is just gradually getting less thick, you may not notice that. So you have to document it. It's very hard to see over time. And when you're looking at yourself every day, you're just not going to notice it. And so you got to just be on top of it to really make sure you have your pulse on it out of the gate. So again, this is Dr. Jake here. Again, I deal with this with patients all the time. Again, androgenic alopecia, more on the guy side. Women can still have some of it, even though it's male, right? The male hormone that causes it can still be a root potential cause in some women. Women, more telogen effluvium, female hormone issues, thyroid, menopause stuff, and of course the gut can be a big role due to the nutritional component at number 5 out of the gate there. But if you guys want to dive in deeper, if you need support on this, you want to roll up your sleeve with me, I'm happy to help you out and dig in and get to the root cause. There'll be a link down below where if you want to reach out, click on that, schedule with my staff, and we're happy to dive in and get to the root cause, guys. All right, I hope you enjoyed. If you did, put your comments down below. Thumbs up, sub. Love to see it. All right, guys, take care. Have an awesome day. Bye.